Get ready for less pain, faster recovery on how modern surgeries are changing the game with our experts on Good Morning Doctor, brought to you by Mount Elizabeth Hospitals. It's possible.
Good morning.
Welcome to the morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
Good morning, Singapore, and welcome to the biggest and best breakfast show in the world. That is Good Morning Doctor Day, and we want you to send all your questions. We've got an orthopedic surgeon this morning. All your questions, 88550920. Our guest for this morning is Dr. Alan Cheung, orthopedic surgeon from Mount Elizabeth Novena Hospital. Good morning.
Good morning, Glenn. Good morning, Tim. Thanks very much for having me on the show. It's great to be here.
Thanks for coming in. We know how busy you are.
Absolutely.
One of the busiest orthopedic surgeons, I would say, in the world.
And also one of the most dangerous.
Dangerous?
Orthopedics. Yeah, because he's MMA practitioner all.
Okay, you go.
We're gonna be extra polite this morning to our guests.
I think the first time I met Dr. Alan Cheung was at Evolve.
Yeah.
Yeah. I think you had just started your Brazilian Jiu-Jitsu journey.
Yes, that's right. I think that was sort of around 2018, and I know you're a bit of a martial artist yourself, Glenn, so
The
I know
same,
you're very
Brazilian
modest.
Jiu-Jitsu
That's
and
right, yeah.
Muay Thai.
Now, when you first met, it wasn't across each other in the ring or anything. No, right?
I think Glenn probably submitted me a few times.
No.
probably. It's much more
I
experience
don't
than
think
me.
so. I don't think
Yeah.
so. We haven't rolled together though,
No,
right?
Maybe not. But that time was interesting because it's around the time I began working as a ringside doctor
Right.
for the Mixed Martial Art Franchise One Championship. And a lot of my friends were training MMA, mixed martial arts or combat sports. And so that's why I decided to join Evolve and train in Brazilian Jiu-Jitsu and also Muay Thai. So it was really exciting at the time because when I was training, I could see a lot of the competitors in one, like Alex Silva, you probably remember him,
Right.
Crew R, and they would train me during the week, and then I'd watch them compete at night time in the octagon, and able to look after all the martial artists as a kind of ringside doctor as my side job.
Right.
Yeah.
I think mixed martial artists are such a unique breed of people.
Yeah.
They are the gentlest people when they are teaching.
Yep.
But in the octagon, man,
Yeah,
They're
it's all out.
beasts.
They flick a switch,
Right.
and boom, it's
And that's
incredible.
it must be very stressful. There's a lot of pressure as a ringside doctor at one of these events because, it really comes down to you to determine whether or not they are fit to carry on with the fight.
Well, I think it was great to work for an organization like One Championship because they have very good safety protocols, because it's not just those few minutes in the ring, it's a whole week before where the athletes are evaluated, where they go through tests, you examine them, and you make sure they're actually fit to compete. So you know them very well before they step into the ring, and these are very fit individuals. And the rules are such, the safety rules are such that really the athletes, once they're down, they don't take a lot of damage because the referee stops the fight immediately.
Yep.
Yeah.
Okay.
Okay, now, Doctor, we're going to continue this conversation on the Big Show TV. I've got lots of questions because nowadays, more and more people are taking part in, events like High Rocks, for example.
yeah.
In the past, it used to be the Spartan races and all that. Question is, are more people getting injured these days? And how have you been helping them? We'll discuss that on the Big Show TV. Meantime, here's Taylor Swift with I Can Do It With a Broken Heart on Kiss 92.
All right. Are we on Big Show TV already?
Yes, we are.
Hello, everybody.
We were on the Big Show
all
TV
this
from the
Mark.
start. He's quite new to this.
Yeah, I'm new. This is my first week, right?
It's just trying to make me feel better. Thank you.
We're live on Facebook and YouTube right now. Once again, 88550920 if you've got questions for Dr. Alan Cheung.
All right. So, okay, we're very excited. You were just asking, right?
Yes.
Before we went into this, are more people getting injured nowadays, particularly because of the popularity, not just in combat sports, but also, high-intensity events, sporting events?
I think that's a really good question, Tim, and I would say that they're completely different sports, and I know that because funnily enough, you should mention High Rocks, because I started doing that last year. I did 3 High Rocks events last year. For those who don't do High Rocks, it's basically a fitness race event which involves running 8 kilometers with 8 high-intensity stations each kilometer, and you've got to do it as fast as possible. So it's a pretty exhausting event, but really, really fun.
That's
So-
you right there. Everyone's watching
Oh,
right
look at
now.
that.
That's a good shot.
That's
Yeah.
my friend Ron behind me. He's
Right.
my race partner.
Did you do a duo?
Yes, you can actually do it either singles, which is pretty exhausting, or as a doubles, which is pretty good, or even as a relay of 4 people.
Oh, that sounds good.
Yeah.
I would love to do that.
It's good to start off with, yeah. So going back to your question, do people have more injuries? I would just say not really. They're 2 different sports. They just have different injuries. So martial arts, is you don't actually, it's not as dangerous as people think, because you don't go 100% all the time. And you tend to pick up things like strains, to your knees and elbows and shoulders, and rarely anything kind of major. And I think in high rocks, it's more overtraining because people, they get really hyped up and they just don't know how to or when to rest and recover, because that's equally as important as building up your strength.
So you're saying that the injuries actually happen even before the event while they're prepping for it than rather at the event itself?
For high rocks, absolutely, because, during that event, that hour and a half, I often see overtraining injuries, particularly in the elite competitors, like stress injuries to the bones in the feet and the shins. So that's quite common with these sort of events.
So they're practically wearing out their joints before.
Don't say that, Glenn. No.
I have so many friends who are preparing for the next High Rocks. There was one in Bangkok recently, I think, if I'm
that's
not mistaken.
right,
And I think the next one could be in August here in Singapore.
It's fairly soon. I think it's in the end of June, actually, much sooner than that, yeah.
So I've got friends who have been training for that as well. And I've got to ask you this, okay? What's the difference between a tennis elbow and a golfer's elbow?
Well, they are similar, kind of opposite ends of the spectrum in terms of the tennis elbow is on the outside of your elbow, but the
Okay.
golfer's elbow is on the inside.
Right.
And they both occur when you have sort of repetitive strain from the forearm muscles. The ones on the back insert on the outside. So during tennis, basically if you do a lot of top spin, a lot of flick of the wrist when you serve or backhand, or you're gripping too tightly on your racket, that can aggravate the tennis elbow. But many people in many different sports will get tennis elbow. So it's not just tennis. And golfer's elbow is when the muscles at the front of the arm, the forearm, they insert on the inside of the elbow. And if you get, if you're starting with golf and you hit the ground a lot, as you do when you're trying to hit the ball, then those shock, the kind of the reverberations can sort of cause stress and strain to that insertion point on the inside of the elbow. So that's basically the difference.
So when I was training really hard at the range for my golf, I used to get golfer's elbow all the time, and I realized exactly what you just said.
Yeah.
I'm hitting the mat over and over and over again, and that causes the golfer's elbow. So I don't go train anymore. I just play on the golf course. I just play a little bit more, and I'm completely fine now. But the reason why I'm asking this question is because I've got a bunch of friends who have been training for High Rocks, and they've come down with either a golfer's elbow or a tennis elbow, and they can't figure out why. And I'm telling them it could be because they're doing like their barbell things with the barbells, and like what you said earlier on, maybe it's their wrist motion or something like that. Could it be a possibility?
I think a lot of people, myself included, when we start High Rocks, we don't really appreciate quite how demanding it is, and how much a jump it is from doing not very much to suddenly saying, I'm going to run 8 kilometers and basically do an exercise like crazy in between. So a lot of the training for that, you have to carry kettlebells. You've got to do a lot of this thing called the ski erg, which is a bit like skiing, and you've got to do a lot of rowing.
Right.
And all the strength training puts a lot of stress on the forearm muscles, and that's why they're getting this condition. But the good news is that once they take a break and rest, it should get better naturally.
Okay.
You think one of the main reasons, especially in events like that, is because everyone's just focused on speed and timing rather than form?
Well, I think if you have a personal trainer, and I think having a trainer and doing strength training is important for pretty much any sport, including High Rocks and martial arts. And I have to give a shout out to my personal trainer Lee Withers at Peak Gym, who helps me. Is that the technique is you're right. It's just as important as how strong you are and because it helps with the efficiency of the technique. like with ski erg, there is definitely a way to do it, so you don't kind of use too much inefficient motion.
Right.
So there's always a science, and when you're pushing the sled, there's like 3 different positions you can push it. And for me, I've tried every single one, and I know which one works for me. So there's a lot of, just like any sport, there's a lot of technical nuances.
Right.
Yeah.
Okay, we're going to go back on air, and I've got a few more questions for you regarding the human body and how strong are we.
Reminder as well to everyone who's watching us on Facebook TV, if you have on Big Show TV, if you have questions as well, please in the comment section, okay? And of course, we'll share them with Dr. Cho.
You're monitoring that, right?
Yes, I am. Man.
Okay, cool. Questions via our WhatsApp or Facebook.
Someone even said, "I love his English accent."
I can't help that. It's not a fake accent. I was actually born in UK.
Well, they love it.
There you go.
They love it.
Okay, stand by. Traffic update.
Oh, for you, I'd leave it all.
Kiss 92 traffic.
On the PIE towards Changi Airport, a vehicle has broken down after To Guan Road exit. Opposite direction, PIE towards Tuas, heavy traffic at Adam Road entrance. On the SLE towards CTE, breakdown after Woodlands Avenue 2. KPE towards ECP, heavy traffic between Buangkok Drive and Tampines Road. And on Orchard Road towards Bras Basah Road, an accident has occurred after Buyong Road. Avoid the right lane and of course, drive safe.
Welcome back to The Big Show and The Big Show TV. We are live on Facebook as well as YouTube right now. Our guest for this morning is Dr. Alan Cheung, orthopedic surgeon from Mount Elizabeth Novena Hospital. Now, doctor, what are some advancements in treatments or techniques today, and what do these mean for your patients? Because as we've established earlier on, I mean, more and more people are getting injured. I mean, there were other techniques to treat patients, but surely there have been advancements.
Sure. Well, there's always advancements, and for my practice, I think one of the biggest advancements recently is robotic surgery. So for some of the operations I do, like joint replacement in particular, then I use a robot to plan and also perform my surgery. I find that's very effective and very precise, and it's really changed my practice. But for younger patients, then I'd say the biggest advance is the use of what's called orthobiologics. So that's like injectable materials we as doctors can inject into joints and tissues to try and help them heal quicker. So for one example is something called PRP, or platelet-rich plasma. I'm not sure if you've heard of that before, but the platelet is a cell in your blood which is involved in the healing process and also for blood clotting, and that's injected in high concentrations. So you basically have your blood taken, a centrifuge is used to spin down the blood so that you can separate the platelets in a particular layer, and that's injected into your joint or soft tissues to help heal the damaged structure. So those two things, robotic surgery and the PRP and orthobiologics, are the sort of new advances today.
PRP, I want some. I think I need that for my
Happy to
left
give
knee.
you some.
Yeah, you just add it to your vodka, knock it back, and that's how you ingest it now.
But seriously, I do think I have a problem with my left knee. I've been saying this for years now. I
Yeah.
haven't gotten it checked out.
You should get it checked. I think
Right, so
it's good you mentioned that, because a lot of people with aches and pains and problems, they just carry it around with them. They never get it checked out, and it can lead to problems in the future. So particularly for athletes or people who do any sort of sport, not just martial arts, if you've got a niggling injury, you pick up something, it doesn't go after a few days or a week, then do get it checked out, because you may have damaged something.
And of course, I mean, age plays a big part as well, right? I mean, when you were younger, maybe your joints were probably more youthful, like the rest of you.
Yeah,
You could do all
yeah.
these things. And now as you get older, you may not really know exactly what the condition that your joints are in. You should probably get a checkup first. Supposing, 10 years later, now you're in your 50s and you suddenly want to take up Brazilian Jiu-Jitsu, you should get some sort of an assessment before you embark on the new sport, right?
Yeah, that's a really good point, Tim. I think if you are an older athlete and you're new to exercise, particularly if you may have some medical conditions, best to see a sports doctor who can check you out, check out your joints, check out your organs to make sure that you're safe to train. But I don't think age is necessarily a barrier to doing any sport. I think you really are, as young as you feel, and as long as you can do it at a sensible rate. And the main thing for older athletes is recovery. So I'd say that if you train very intensely twice a day and don't have a rest in between, you're more likely to pick up an injury. But if you rest in between, you get enough sleep, you have good nutrition, you cut down your alcohol, then you're much more likely to have a more enjoyable experience and fewer injuries.
Right. One of the oldest Brazilian practitioners here in Singapore, I'm talking about pretty high level, is close to 80 years old, right?
So, you can do it at any age, maybe not the intensity, but you can still use skill and experience to enjoy yourself on the mats and to train martial arts.
All right. We are talking to Dr. Alan Cheung, orthopedic surgeon from Mount Elizabeth Novena Hospital. Let's continue this conversation on The Big Show TV. It's 8:21.
Kiss 92 time check by Pootie.
Okay. And back to the question I wanted to ask you earlier on.
Okay.
So, how strong is the human body in terms of joints? How much and how much can we push ourselves?
Well, I think that that's a really good question, and it can be a dangerous question because everybody's got a limit, and often they find out that limit the hard way.
Oh my God.
So what I would say is that we are, human beings are so much stronger than we actually think we are. And, we are born to survive. If you think about it, we didn't always live in aircon. We lived for hundreds of thousands of years in forests, in plains, in caves. We didn't have modern medicine for, until, 100 years ago. Yet we survived. So that tells us we're actually really, really strong and we're capable of many, many different things. And there's a famous story about a mother who's very small, probably about 50 kilos, who's able to lift a car off her child, her baby, when it got trapped under there because she was just so desperate and wanted to save her child. And obviously, so it tells you that the mind is able to force the body to do amazing things. But on a more normal level, I would say that, we all in Singapore, lead busy lives, whether they're studying or working, and we're not full-time athletes. So we have to pace ourselves to say, okay, if I'm going to, do a sport, I have to be sensible, particularly when I'm starting to build up slowly and gradually, have a good instructor, follow those instructions, and not overdo it, and have good rest and recovery and sleep and nutrition in between to get the best out of it. So in answer to your question, we are capable of amazing things, much stronger than we think we are, but on a day-to-day basis, we just have to be sensible and build up gradually.
Okay. All right. So I got a two-part question. I want to go back to the exciting world of combat sports and being a ringside doctor. What is the most common injury that you see MMA athletes face? And number two, what is the most serious injury you have attended to ringside as a doctor?
Good questions. I was going to ask the doctor, those questions.
Okay, they're excellent questions. So what I would say is, if we go back to what mixed martial arts is, it's really a combination of striking sports like boxing or kickboxing or Muay Thai, and also a grappling discipline such as Brazilian Jiu-Jitsu called BJJ, or wrestling. And, MMA is made famous by the, UFC in America, which started about 30 years ago. And it has a bit of a reputation of being kind of rough. But actually, most practitioners of mixed martial arts, Brazilian Jiu-Jitsu or Muay Thai, they don't compete professionally. And therefore, it's pretty safe and the injury rate is quite low, if believe it or not. So most people who train grappling sports, they'll get some strains or contusions to the ligaments or their joints around the knee, elbow, shoulder. But rarely would they get anything serious like a torn ligament, like an ACL tear or a dislocated shoulder. Mainly because also they have the ability to stop and submit and tap out, literally tap out to say, stop, you've won that round, and then start again. Striking athletes, they tend to get more, they tend to get sort of bruises and contusions and maybe leg injuries if they kick the bag too hard or injure their ankle or when they land awkwardly after a kick. But because most striking athletes do not compete professionally and don't spar full contact, and even when they do spar, they have protective equipment like gloves and headgear, they don't tend to pick up concussions or head injuries. So actually there is a misconception about mixed martial arts and martial arts in general being dangerous, but it's actually a relatively safe sport compared to a lot of other sports which are full contact, like football, basketball, or rugby. I see a lot more injuries, a lot more severe injuries that require surgery from those sports. And personally, I've dislocated both my shoulders playing rugby as a kid, so I know that that it's much a high injury rate, believe it or not.
Wow.
Yeah. So going back to your question of what's the most severe injury I've seen. Well, fortunately, because I worked in an organisation like One Championship, which has a very strict rule set and is very safe, and we prepare the athletes carefully. Really, people do get knocked down, but the fight was always stopped before there was a severe injury. We were always able to transport the athletes in a stable condition to hospital for a further assessment. But apart from people being knocked out and there was never really anything worrying or disturbing. I suppose there was one particular incident. There was an American athlete who had a very spectacular jaw injury, broke his jaw in several places, and he posted it on social media, which but he's since left the organisation. But I think that was really it in the sort of 4 or 5 years I was working with One. That's probably the most severe injury that I saw.
Good looking guy. I can't remember his name now. He had a sister as well.
He was blonde. Yeah, that's right. I should know better. Yeah.
Yeah. Okay. That was that was an injury he did not expect.
Okay. All right.
Yeah.
Well, I was a little worried, that Dr. Alan was going to say, I saw a guy get punched and his eye flew out of his head.
I think that's fantasy.
We'll save that for the video games.
But doctor, there are so many orthopedic surgeons out there. I've heard only good things about you. What
Thank
in
you very
your
much.
opinion makes you stand out from the rest?
Gosh, well, I think you've really put me on the spot there, Glenn. I also think there are excellent orthopedic surgeons out there, and I don't think I'm particularly. I try not to think of myself that way. I just try and do what I enjoy, what I love. That's why I do martial arts. I just try and practice medicine the way I was taught, try and do my best for the patient and caring, try and be a good communicator and do my best surgically. So that's all we can do.
Yeah. But I think it certainly helps that, you're involved in the community as well. And so, you observe how people take care of themselves or don't take care of themselves. And I'm sure people come up to you and ask you for your advice as well.
Yeah.
Like, how can they better take care of their joints?
Sure. Well, I'm not very well. I have to say, although I've been practicing it for a long time, I'm actually not very good at Brazilian Jiu-Jitsu, but I do understand the language that people use. Say, I was being injured using a special technique like a kimura or a rear-naked choke or an arm bar or, knee bar. So there's a lot of technical aspects to the sport. And then if they do injure a particular part of the body, I say, well, perhaps because you like to play this position normally, you should avoid that and switch to playing guard or being a
Okay, hold on, Alan, for a bit.
Kiss 92 Traffic.
PIE towards Changi Airport, heavy traffic at the TPE exit. We also see a vehicle breakdown after To Guan Road exit. Opposite direction, PIE towards Tuas, heavy traffic at Adam Road entrance. SLE towards CTE, breakdown after Woodlands Avenue 2. And on the KPE towards ECP, heavy traffic between Buangkok Drive exit and Tampines Road exit.
We're back with Dr. Alan Cheung, orthopedic surgeon from Mount Elizabeth Novena Hospital. We're having a good time talking to you and learning quite a bit as well. Good catch up too. Now, doctor, what is the most common surgical procedure that you do?
Well, good question. I think in younger patients, it's knee surgeries like ACL reconstruction, the anterior cruciate ligament, which tears if you sort of twist your knee very badly, and also meniscal injuries. So the meniscus is like a shock absorber that sits in the middle of the knee, and often if you twist your knee badly in football, for example, then you can tear that. So those are the two most common things in younger patients. In the older patient, then, in their 60s or 70s, then it's usually robotic joint replacement of the knee or the hip.
Right. And is it keyhole surgery these days?
The younger patients, yes, it's all keyhole surgery, so through very tiny incisions. But for the older patient, then maybe a 10 centimeter incision for their knee replacement, for example.
And what's the recovery time?
Well, I think that for joint replacements, actually, people can walk straight away. That's quite amazing. And some within 2 weeks are walking without any walking aids around their home. So, and nowadays they don't need to stay very long in hospital. For the younger patient, I always advise that it's going to take a lot longer because your body needs to heal. So although you can walk straight over the crutches, you might not be putting your full weight on the leg for around 4 to 6 weeks. And you need to do several months of physiotherapy to train your body back to how it was before. So not a quick fix for those younger patients with sporting injuries.
Right. What would you say to someone who knows he or she needs to go for surgery, be it, a hip surgery or a knee surgery, but has been putting it off for a long time? I mean, because they're scared. They're scared of, going for this surgery. Do you have anything to say to them?
I think it's perfectly natural to be apprehensive and to be worried because it's the unknown, particularly if you've never had a surgery before. So I would just say that, if you tried all the non-surgical things like physiotherapy or injections and your problem really is so bad that you need surgeries, find, a doctor or a group that you're comfortable with, who can explain things well, put you at ease, maybe even introduce you to other patients who had the surgery successfully, and basically, explain all the pros and cons with the procedure. But yeah, I mean, you're right. It's perfectly natural as a human being to say, "Oh my gosh, I'm scared of that." But you've got to weigh up, the benefits of being pain-free in the long term versus short-term discomfort.
Yeah, the choice is yours, right? I mean, look, if it's not interfering in the quality of your life, then sure, you don't have to go for it. But if it is,
yes,
then do
definitely.
something.
Yeah, got to do it. Now, earlier on, I mean, especially since we're on the topic of surgical procedures and things like that, you mentioned there was a fair bit of robotics that's now being involved, right?
Yeah.
Who controls the robots? Is it you by the side with a nice fancy remote control, or is it this day and age everything they rely on AI, right?
Yeah, that's a really good question. And at Mount Elizabeth Hospitals, they're kind of like a pioneer of robotics because they have so many different types of robots. And so it really depends on the type of surgery and the the specialty that what the type of robot is and the style of robot. For example, for orthopedics, the surgery that I use, I'm right up close to the patient because I have to make the incision. I have to basically expose the bone, moving the soft tissues aside. And the robot is really a guide. I use a robot called the Makoplasty robot, which I pre-program to stop me from going outside of a particular area. So I only take away the exact amount of tissue that I need to take. So I'm right up there close. I can see what's happening straight away. But I've worked with other robots in the past called RoboDoc, where you just do the exposure, press the button, and the robot does all the work.
It's like Jarvis from Iron Man.
Well, it can't talk to you, but it can certainly do some of the work for you.
Yeah.
Whereas other surgeons in other fields, like general surgery, doing operations on the stomach or the abdomen, they'll use a robot called the Da Vinci robot, where they sit at a console outside the operating space. So it's all done by sight, whereas I'm up close and I can actually get more feedback from feel and touch.
Wow, exciting times.
Yes.
Yeah.
Yeah.
Amazing. Thank you very much, Dr. Alan Cheung,
Thank
for
you
coming
very
in
much.
today
That's
and
very kind of you.
talking to us. If you would like a consultation, go look for Dr. Alan Cheung. Okay, he is at Mount Elizabeth Novena Hospital.
Thanks
you
very
so
much. Thanks for having me on the show.
Thank you, Alan.
Okay.
You've been listening to Less Pain, Faster Recovery